On the Medical Watch this afternoon, the McHenry County Health Department is reporting its first pediatric death from RSV this season, and the number of cases at some hospitals is on the rise. Dr. Julie Holland is a pediatrician at Advocate Children's Hospital. She joins us now to talk a little bit more about it. First of all, what is RSV and what are the symptoms?
So RSV is a virus. It is a common cold virus, and for most people and most children, it's a mild respiratory illness. There are a lot of kids, however, who get lower respiratory illness, meaning it gets into their lungs and causes difficulty breathing and a need for oxygen and makes kids quite sick, and it really affects the youngest kids, the less than 1 or 2 year olds, the most.
And so how do you know when it's just a bad cough like my youngest son and so many kids are dealing with nowadays, and something that you should be worried about and seek out medical help?
It really has to do with how much difficulty your child is having breathing. So if they have a high fever and they're breathing very quickly and they look like they're really struggling, that's the time to get help right away. Kids who are happy and eating and smiling and laughing, but just have a runny nose, a mild cough, or a low-grade fever, those kids are generally not in need of immediate medical attention.
So we've had the one child death in the far northwest suburbs in McHenry County. Give us some perspective, though. Is RSV worse this year, or is it too soon to tell?
Well, yeah, I just wanted to extend my sympathies to that family. What a tragedy. And the sad truth is we see about 100 to 300 deaths a year from RSV. We're at the very beginning of the season. It's increased rapidly in the last 3 weeks. So we won't really know for a while if this is going to be a worse season than normal. But we certainly are seeing a lot of it. And pediatric hospitals and pediatric hospital beds are full with kids who are quite sick.
So what can parents do to help their kids, especially since it affects so many young kids?
Right. Well, this year and last year, there is a brand new treatment that is really quite effective. So actually, there are two. For moms who are pregnant and delivering in the winter, they can get a vaccine while they're pregnant against RSV, and that's called Abrysvo. And that's pretty good at protecting infants after they're born during the RSV season. The other option is babies can now get an immune globulin product called Beyfortus. And they get that by injection either in the hospital right after they're born or in their pediatrician's office. And that also is very good at preventing about 80% of RSV hospitalizations and 80% of severe illnesses. So lots of good options for the youngest kids.
Do you find a lot of parents have a lot more questions about vaccines than they used to?
There is a little bit of that, and I think a little bit of questioning your doctor and trying to make sure that this is the right thing for your kid is a good idea. However, these products have been really well researched and well proven to be safe and effective. So in this case, I think this is definitely worth getting, but parents should always feel free to ask questions.
And forgive me if you said it, how soon after the vaccine do you get protection from RSV?
So for the vaccine that moms get, it takes about 2 weeks for them to get full protection to their babies. So if they're not pregnant for 2 weeks after they get the vaccine, those babies are not protected and need the other product. For babies that get the immune globulin, the protection is really pretty much right away because you're giving baby antibodies against the illness.
Good to know. Dr. Julie Holland from Advocate Children's Hospital, always appreciate your time. Have a great day.
Thanks, you too.